Good afternoon. I am your host, Dr. Mylaine, and you're listening to and watching Awakened Wellness Now. And today's topic is going to be the difference between blood deficiency and anemia that every woman should know, regardless of age. And so this is a common misunderstanding that we have in Western medicine. We tend to confuse anemia with blood deficiency. And in Chinese medicine, they have a pretty good explanation as to what blood is and what happens when we are deficient and what to do about it. And it affects women in particular because, as you may have heard in previous podcasts, we are made of blood. Women are made of blood. Men are made of qi. Or vital energy. So we are made of vital substance. Men are made of vital energy. And of course, we both have qi and blood, male and female, but it's a matter of relativity, right? So for women, we use and consume our blood more in our roles as women in terms of reproduction, menstruation, breastfeeding, and pregnancy. And men obviously don't menstruate, they don't get pregnant, they don't breastfeed, right? So they don't have that role, which heavily involves blood. And so in Chinese medicine, they understand that women are of blood and men are of qi. So what is blood and what does that have to do with anything, right? So a lot of symptoms that women tend to have more than men. Not that men don't get these symptoms, but women tend to be a little bit more vulnerable to these symptoms, are misunderstood in Western medicine. And because we are trained to look for anemia and not blood deficiency, most people don't have anemia, but a lot of women have blood deficiency with normal blood work. And so it's important to distinguish what these two things are, so that we can start to understand why we keep missing the mark in Western medicine with women who are blood deficient and what it means in terms of women's health, societal health, spirituality, and everything, right? In Chinese medicine, the blood houses or the blood nourishes the mind. And again, the mind is not the brain. The mind is kind of what we would equate to perhaps the soul or the spirit. It's a non-physical structure, the mind in Chinese medicine. The brain is a physical structure inside of our skulls. But when they say that blood nourishes the mind, they're not talking about the brain. Although blood nourishes everything physical as well, it grounds the mind and it nourishes or feeds the mind. And so a lot of anxiety, a lot of depression, a lot of mental health issues are from lack of blood nourishing the mind. The mind is housed in the heart, according to Chinese medicine. And again, the mind is not the brain. So they're not suggesting that the brain is in the heart. They're suggesting that the soul or the spirit is in the heart. And we are starting to see that there is what we could define as a tiny little brain inside the heart. That they call the heart brain. That was discovered in the 1990s. So there are about 40,000 neurons in the human heart that actually send more information to the brain than the brain sends to the heart. So that was really mind-blowing and very much in line with what traditional Chinese medicine tells us, and also many other traditions, right? We hear about the Sacred Heart in Christianity. Many older traditions, ancient traditions, tell us to look within. And when they say to look within, what they mean is to go within the heart, right? And we talk about heart-centered living. And so it's really important to understand blood, because blood is what allows the spirit or the soul to be still, so that it can I'll call it download, right? Download information or wisdom, and to ground that knowledge and wisdom in the world requires blood. And because women use up blood so much, and also because stress uses up blood. So that's important to know, and we'll go into that. But because women are susceptible to stress just like men, but also women use their blood so much more than men. We tend to be more vulnerable to stress. And so we tend to have our blood consumed, not just by menstruation and pregnancy and breastfeeding and all the other, evolutionary functions that we have, but also by stress. And so the mind tends to be a little bit more ungrounded, if you will, in women because of that. And so this is why women have twice as much depression and anxiety as men, is because, we don't learn in our culture here in the West to protect our blood. And so we don't learn in our Western culture anything really about that and what to do about it. And so it kind of leaves us in the Western world a little bit more vulnerable to diseases and conditions that can be made worse by stress. And so what is blood? Blood is what is called vital substance. It is a yin type of energy in Chinese medicine. So blood, because it's yin, is very grounding. It's very stable. And it's also the thickest fluid, according to Chinese medicine, in the body. And so it's very nourishing and it's very cooling. And it carries energy. So blood innately has energy within it. And it, nourishes the body. So it carries the energy that the body makes all around the body to feed all of the different cells throughout the body. And if we are blood deficient, what that means is there are parts of the body that are not receiving enough blood. And if they don't receive enough blood, then because blood carries oxygen and nutrients and hormones and many other things, if blood is not reaching every cell, there will be cells deprived of nutrition and oxygen and hormones and other factors that they need to actually function. And so what will happen then is we will start to get dysfunction, right, or malfunction. If that goes on long enough, then we can get what we would describe as diseases. But first we start to have symptoms, right? So anxiety is a big symptom. Insomnia is a big blood deficiency symptom. Another thing is people feel dizzy. So if you're laying down and you get up and you feel dizzy and you have to just kind of stop and wait, for everything to equilibrate, that can be a sign of blood deficiency. Also, floaters in your vision. That's a big sign of blood deficiency. Not light sensitivity, but when you blink, you kind of see these little things floating around in your vision. And there's nothing actually, there. The eye doctor doesn't necessarily see anything, but that is a sign of blood deficiency in traditional Chinese medicine. The other thing is if you check the pulse, it will be usually thin and weak. And so if you're someone, that's hard to get the pulse on, you might be blood deficient. The other thing is when we look at the tongue, if it's pure blood deficiency, we'll see that the tongue is pale because there's literally not enough blood in the tongue. And so it doesn't have that characteristic pale red color. And so those are all signs of blood deficiency. The problem is you won't see that in the blood work. So you'll go to the doctor, they'll draw your blood, but it'll be pretty normal. So that's the difference between blood deficiency and anemia. Anemia, by definition, in Western medicine is a reduction of the red blood cells circulating in the blood. But, red blood cells are not the only thing in your blood, right? So red blood cells will carry your oxygen around and your iron around, which holds onto your oxygen. But that's obviously not the only thing in blood. And so because those are the only things we measure when we're looking for anemia, so we measure what's called a hemoglobin level or a hematocrit level. We also measure the actual red blood cell volume. And so only if that very small segment of blood is low will our blood work be abnormal. And then we will be labeled with anemia. But there are thousands of things that are carried around by your blood, and we just don't have the blood work to check for all of it. And so we will miss the diagnosis of blood deficiency because we are only looking for anemia. And so it's important, if you have symptoms of blood deficiency, to be aware that even if your blood work is normal, that does not mean that you don't have something going on. It's just not visible in blood work. Sometimes we can capture that in cellular level testing. So because when we go and we get our blood work done, what we're looking at is really the centralized circulation of blood. In other words, we're looking at what's flowing through our arm, which tends to flow through the main organs. But we're not looking deep inside the organs at those levels that are deep inside the organs or deep inside our tissues, where in things we would call capillaries. So this is a large blood vessel. We go get our blood work done. They poke us here usually and draw blood. This is not reflective of what's inside your cells. It's not reflective of what's deep inside your tissues. And there's blood flowing there as well, but you won't capture that with blood work. And that tends to be where the deficiencies are that we miss with blood work. It tends to be deep inside the tissues of the body, and we just don't have testing really available in our Western model for that. Functional medicine has some testing available, so we can test inside your cells for different things. So we can test, for example, inside your immune cells for vitamin and mineral deficiencies, which is different than blood work. So we're checking cellular levels, deeper levels, if you will. And what we usually notice is that blood levels and cellular levels don't correlate. And we used to make the mistake in medical school of thinking that that was because one test was inferior to the other. And so because blood work is the gold standard, we would always assume that the blood work was correct and the other stuff was incorrect because it did not meet what we call the standards. And then as I studied Chinese medicine and I studied functional medicine, I began to understand that it's not that they're inferior. They're measuring two different locations in your body, and they're actually both correct. And so blood sugar was a really striking difference for me. We were always trained to believe that the finger stick, which is a capillary level or a tissue level sample of blood sugar, was inaccurate, and that in order to confirm, we had to check blood work. And so we always had it in our minds that blood work is accurate, capillary blood work is not accurate. And it was later that I realized, no, it is accurate. It's reflecting what's there as opposed to here. They're two different environments. And if we stay stuck here and we never look here or deeper in the tissues elsewhere, we'll never know what's going on in the tissues elsewhere. And we'll keep making these assumptions that everything's okay when it's not, right? Do you have questions? Yes. Question, I've asked my doctor if taking an iron supplement would be beneficial. She says no, yet I have friends that say I should. Do you think iron supplement is a good idea? Only if you're iron deficient. Not great to overtake iron, to overconsume iron, as we've seen with COVID. A lot of post-COVID is due to iron deposits in the body from the displacement of iron from our red blood cells by the virus. And so iron is actually toxic, but it's also essential. So there's this very fine line with iron. So you don't want to over consume iron. So I would say only really if you're, deficient in iron, should you take iron. But that doesn't mean you're not blood deficient, right? So if you have spots in your vision, postural, we call postural dizziness, like if you stand up too fast, if you feel dizzy, if your tongue's pale and your pulse is weak, or if you have difficulty sleeping, things like that. Sometimes palpitations are a sign of blood deficiency. So if you get your heart checked out and there's no explanation, and no replication of the palpitations on an EKG or a Holter monitor, that probably means you're blood deficient if your tongue is pale and your pulse is weak. And so there's so many things in the blood that could be missing. You don't want to just make the assumption that it's iron. That's just because that's what everybody talks about, because it's the only thing we measure with blood work. We only measure the red blood cell counts. And so we assume if those red blood cell counts are low and, therefore iron levels are low, that we take iron, but there's so much more to the blood that you need to take, which we'll talk about towards the end of the podcast. We'll talk about blood nourishing food as opposed to supplements, because there are so many things flowing in your blood. It would be impossible to take a supplement for all of them, right? So it always boils down to food and nutrition, and also protecting your blood, which we'll talk about as well. Question, I just caught the end of the blood and spirituality. Sorry, I was late. No problem. Could you go over the blood and spirituality one more time? Yeah, so in Chinese medicine, blood is what is called vital substance. It is a yin energy. So it is a grounding, cooling, calming kind of energy, blood. And so in Chinese medicine, it is understood that the blood nourishes the mind. The mind in Chinese medicine is kind of what we would equate to, not exactly, but the closest thing we would equate to it would be spirit or soul. And they say that mind is everywhere. So mind is unbounded in Chinese medicine, and it does not equate to the brain. So when they say mind, they don't mean brain. They mean the infinite layer of your being, if you will, and blood nourishes that aspect inside your body. And so blood is linked to spirituality in the sense that it grounds the mind. And if you're blood deficient, or if you have poor circulation of blood, or what they would call blood stasis in Chinese medicine. So if something is missing, that will cause the mind to be ungrounded. If something is stuck, if blood is static, or if there's poor circulation, so it's not flowing smoothly, it's not that it's lacking so much as it's not moving smoothly. That also causes a problem with grounding your mind. And blood stasis is actually associated in Chinese medicine with psychiatric disorders like schizophrenia, not just postpartum depression, but postpartum psychosis. Where you're hallucinating and, you don't quite have a grip on 3D reality, or you can't distinguish other dimensional realities from 3D. We call that psychosis. So blood stasis, poor circulation to the point where your mind can't be nourished because the energy is so static and stuck that it's not nourishing the mind. So you can actually have a psychiatric disorder and a psychosis from that. A blood deficiency pattern where the blood is not nourishing the mind would be more of an anxiety, depression type of pattern, if you will. So it's important to distinguish between those two as well, but that's how blood and spirituality are related, right? And so the wisdom that women house, right? In Chinese medicine, menopause is a very special time. And of course, so is pregnancy and childbirth. There's a lot to be said in Chinese medicine about protecting the mother in particular. The baby will always be protected, right? Nature built that in. Nature will give the baby whatever it needs at the expense of the mother. And so in Chinese medicine, they understand that. And so they have a lot of practices to protect the pregnant mother, and then to protect her in particular during childbirth and the postpartum period. Women are extremely vulnerable in the postpartum period. And so there's a better understanding in Chinese medicine about how to protect that. But they also talk about menopause very specifically. When women menstruate, there's a downward flow of energy in preparation to move the blood out of the body. So, the blood comes out of the womb or the uterus out through the vagina. for anywhere from 3 to 7 days in a menstrual cycle, and this happens every 28 days, right, roughly. And so there's this constant every month downward flow of energy and blood. The liver has a lot to do with menstruation in Chinese medicine because it controls the direction of energy. And so the liver is mobilized the week before menstruation to start to move that energy in a downward way. And so a lot of PMS, where the energy is scattered, instead of being organized and ready to move downward, it's scattered. So a lot of women will get breast tenderness and bloating, sometimes irritability because it's scattered upwards. That is what we call premenstrual syndrome, and that has a lot to do with the liver not being properly nourished by blood. The liver houses blood or stores blood in Chinese medicine. And so if you're blood deficient, your liver will not, quote unquote, function properly in terms of how it distributes energy. And so when menopause is starting, that monthly downward flow has to stop. Right. And so in Chinese medicine, they describe this 180-degree turn, and now the energy starts to flow upwards. And they say that menopause is a time when women become extremely wise. Not that they weren't wise before, but women have a kind of a special position in Chinese medicine as they get older in terms of their wisdom. And it's because they say of this upward mobility of the blood, and now the blood nourishes the heart instead of going down and out of the womb once a month. And so this change of energy flow is really important, and it nourishes now the heart. And so grounds the mind even more. And so women sometimes will have kind of this reverse midlife crisis, right, where they become very spiritual as they're going through menopause. Question: now that I'm past menopause, way past, is there a beneficial blessing with the spirituality you talked about earlier? Yeah, I think I literally just answered that one. So yes, that's the benefit, right? Women become wiser in menopause, so they have this kind of position as the wise ones, if you will. And spirituality is a very yin type of energy, and so it does require a lot of blood. And if we don't protect our blood, it becomes very difficult to ground the spirit, right? So that, we're more spiritually inclined, I guess you could say, or wise, right? So there's a difference between knowing something and believing it, right? And so the knowing comes from the mind. The believing comes from the brain. We have to convince ourselves of something with the brain. The mind just knows it, right? There's no convincing. And so that's the difference between the mind and the brain in some aspects. And so I hope that answered your question. Oh my God, eye floaters. I have that sometimes. Had no idea it's blood issues. Should I take a supplement? Yeah, so we'll talk about foods towards the end of the podcast. Blood nourishing food. There are many, many, many. So, we're not going to touch on all of them, but there are ways to protect your blood as well as nourish your blood in Chinese medicine that are known. But you also want to be a little bit cautious, right? You want to make sure that you do actually have blood deficiency and not blood stasis, right? They're two completely different things. So you want to make sure it's not blood stasis. Blood stasis, the tongue tends to be a little bit more dim and kind of purple. And if you lift the tongue, if you do that, you would see that the veins under the tongue are kind of popping and they're kind of a dark purple color. That tends to be more like blood stasis, and that says that it's poor circulation of blood and not necessarily just lack of blood, if that makes sense. But yeah, you can take blood nourishing food as opposed to supplements. Because again, with supplements, you'd have to know, well, what in my blood is low, and then you take a specific supplement. But in Chinese medicine, there are blood nourishing herbs. But again, you kind of want to know, am I nourishing heart blood? Am I nourishing liver blood? What am I nourishing, right? And you'd want to have a sense of what that is before you go and take an herb. So in Chinese medicine, we would actually diagnose a pattern and then prescribe an herb that suits that pattern. So if you have insomnia and palpitations, for example, and your tongue is pale and your pulse is thin and weak, then that's heart blood deficiency. If you have the floaters that we talked about and dizziness, perhaps your menstrual cycles are super short, or you may not even be having menstrual cycles, right? If you're of that age, of course, and your tongue is pale and your pulse is thin and weak, that's liver blood deficiency. So you want to make sure you're taking the right supplement if you're going to take a supplement. Food, you don't have to quite be so cautious with, because food is food. And we're not driving the body in a very specific direction like we would be with supplements and herbs. So that's the only word of caution. We're not diagnosing anything here. We're just giving you a sense of what to look for so that you know who to seek assistance from. So if you have symptoms such as what you described, and you go to the doctor, you have an examination, you get testing done, and there's nothing found, then now that you've ruled out a heart condition or other things, you want to make sure then that you don't stop there, right? That's the point. The point is, don't stop there and assume nothing's wrong. Don't stop there and assume that it's because you're getting older. Don't stop there and assume it's because it's all in your head or it's all stress. You don't want to stop there. You have symptoms for a reason, right? In Chinese medicine, they understand that we live in a cause and effect universe. Like, there's no such thing as a symptom without a cause. There's no such thing as it's just in your head, because your head is part of your body, right? So it doesn't matter where it is, it's still there. And so it still must be attended to. It still must be evaluated and treated. We tend to stop in our Western model when we can't find anything wrong. We tend to mislabel that as normal. It's not, right? Let me just make sure. Statement, last show you mentioned the connection between being cold and eating warm food. Right on. I took your wisdom and changed my diet, feeling great. Thanks for sharing your wisdom. Oh, wonderful. That's great. Yeah, temperatures are a really quick fix. That's what's really nice about that. If you're just eating the wrong temperature food, once you make that switch, it doesn't take long to see the benefits. Now, that may not be the only switch you need, right? Because obviously we don't have a means of knowing what else is going on. But I'm very happy to hear that that's helped you. And it's just such an important thing to know that, again, we just don't talk about these things. And so nobody really knows that they can be self-empowered to do so much for themselves once they know, right? Once they understand. So thank you for that. That's wonderful to hear. So back to blood deficiency, right? And so once you know that you have blood deficiency, right? And also the other really important symptom is fatigue, right? I left the most important one out, or the most obvious one, is you're tired. You tend to be dragging. Blood deficiency tends to hit people roughly between 1 and 3 p.m. They just would feel like they would just go take a nap. That tends to be, not always, there are other things responsible, or could be responsible, but between 1 and 3, people tend to note that they're tired when they have blood deficiency. And again, you would confirm that, but with a pale tongue and a thin, weak pulse. You can have blood deficiency and not have a pale tongue, right? Because you could have other things going on that kind of compound the pattern. And so it's not always that blood deficiency has a pale tongue, but if it's pure blood deficiency, you would definitely have a pale tongue and a weak, thin pulse. And so what are the implications of that, right? So stress can be either physical, perhaps there's an illness present, or you have a very demanding job or sleep deprivation, something like that. So that, physical stress. Stress can be psychological, fear, afraid of things that might happen, or ruminating about things that have happened in the past, right? So this is like a psychological stress. Anxiety, tends to manifest when we are thinking about future or past things that we have no control over, right? And so not being present is a source of stress. And then there's hidden stress. So I call that stealth stress. And that's subconscious stress. So it's like you don't even know that you're stressed out because it's all in the back of your brain, buzzing around, but it's not in your conscious awareness that you're stressed out about something. The problem with any type of stress, even good stress, right? So we understand there's good stress. I go to the gym, I lift heavy weights and my muscles grow, right? That's good stress. But even good stress can be bad. So if I already have all kinds of issues with stress, and then I'm adding the heavy weightlifting on top of that, that could be problematic for me, right? So I have to make sure that I address the other stress factors, and so that my body is not caving in under stress, whether it be good or bad stress. And so the thing about stress that's important to understand, in particular for women, is according to traditional Chinese medicine, stress consumes blood, uses up blood, and also stress stagnates blood, or makes its flow stagnant. In other words, it gets kind of choppy. It's not fluid. So when you check someone's pulse that has a choppy pulse, it's there and then it's not there, and then it comes back, and then it disappears for a little bit, and then it comes back. It's choppy. It's there. It's not there. It's there. It's not there. Without a sense of regularity, right? So the pulse is a wave. We feel it, and then we feel it again. So when beats in the wave are missing or just go away, right, we call that choppy, and then suddenly it comes back, right? So that's a choppy pulse. That can be a sign of poor circulation. You don't necessarily have to see it on an EKG, right? You don't necessarily have to see the electrical rhythm of the heart be irregular to diagnose a choppy pulse and poor circulation. So again, this is where testing for stuff can somewhat lead us astray if we're not careful. Now, we need to test for stuff, right? We want to not miss anemia. We certainly don't want to miss a heart arrhythmia, or heart disease. Those are things you do not want to miss. And so you want to make sure that you are tested for those things, but you don't want to stop there, right? So if you feel palpitations and you have a choppy pulse, but your EKG is always normal, your Holter monitor is always normal, you want to keep moving to find the cause of that and to resolve it, right? So you might want to see then a board-certified integrative medical doctor or a doctor of Oriental medicine who can actually diagnose you and then provide recommendations for treatment of whatever the pattern is that is creating the sensation of the palpitations, right? And so stress consumes blood. And so when you already are menstruating every month, or perhaps have gotten pregnant, had children, breastfed them, and then resumed menstruation, right? You're already blood deficient to begin with. And then you have stress on top of that, right? And so this is what, creates the downward spiral, in particular for women. So we can be very vulnerable at the time of menopause, right? And so people make the assumption, well, I'm not going to bleed anymore, so I'll recover. Unfortunately, that usually doesn't happen. In fact, what we see in menopause is women tend to get sick. And people will get confused by that and say, but I'm not menstruating anymore, so I'm not having this blood deficiency thing. Why am I still getting sick? It's because your body can't recover what it doesn't have to recover with, right? So if you had blood deficiency before and you stop menstruating, that doesn't mean that your body will just automatically catch up with the blood that it had lost over the last 20 plus years of menstruation. You have to actually replace what is lost, right? In order for the body to recover. we make this assumption that the body will just regenerate itself, right? And yeah, that should happen. But the problem is when there are things that are missing from your body in the first place, it won't have the stuff to recover with, because those things were lost, right? And so women never quite fill their tank back up, even after menopause. And in particular, if they're under stress, right? So in Chinese medicine, it's understood that the decade before menopause is the most critical to tell you what your menopause is going to look like. And so the decade before menopause, if you're under a lot of stress, you're going to have a very rocky menopause transition, and you will be more likely to get sick. So we see cancer diagnoses go up. We see women having heart attacks more when they're in this menopause transition. We can see a lot of mental disorders, depression, anxiety around the perimenopause, menopause transition. And in Chinese medicine, it's well understood that that's because of stress and the blood deficiency that pre-existed. And so you really, really want to replace the things that are missing, and not just assume that, well, when I stop bleeding, my body will just fix itself, right? The body can only fix itself with what it has available to it. And so if you were not really eating blood nourishing foods before, not getting enough sleep before, not doing all the things that help you recover your blood, you will have this feeling of a downward spiral when you go through menopause. And then what happens is women eventually stop having all those symptoms, and then they think everything's okay, but it's actually not, right? It's the quiet before the storm, because your body doesn't want to be in this free fall, right? So as menopause happens, which it will happen come hell or high water, you're not going to stop menopause, right? The body's not going to say, ooh, we're not ready for menopause because we're missing all these ingredients. Let's put it off. It's a genetic, it's a predestined, genetic transition that will happen. There's nothing you can do to stop menopause. So your body will have to make do and go through menopause with whatever it has in the closet, right? With whatever it has available to itself. And so you're going to go through this transition anyway. And it can either be extremely difficult or seamless, depending on how you prepare for it. And so this is where women can be extremely vulnerable. And so you want to be very protective. So it doesn't mean that, oh, now I'm past menopause and everything's okay. Your body is going to stop the downward spiral because it's going to scramble to take from certain areas of your body to other areas to patch everything up. So your body's really smart, right? So if there's not enough to go around, your body will steal from parts of itself to take to other parts of itself that it considers to be more important. So it will steal from hair follicles to take to the heart. It will steal from skin cells, muscle cells, connective tissue cells. It will take resources from those places because it doesn't consider them as important, and take them to heart, lung, and again, the very center of the brain that it considers to be critical for survival, right? And so that's what creates all of our symptoms. That's what creates the bedlam that we define as menopause for some women. The horrible hot flashes, the night sweats, the anxiety, the palpitations, the insomnia, the weight gain, the aches and the pains, and all of the different things that we associate with menopause are not actually part of menopause. Menopause, by definition, is that you just stop menstruating. That's all. Hot flashes are not part of menopause. Night sweats are not part of it. Weight gain, insomnia, palpitations, all those things are not actually part of menopause. They just happen to flow with menopause if you're under stress. So they are actually symptoms of stress and not symptoms of menopause. Now, again, your body is going to stop the bleeding, right? It's going to somehow, rob from Paul to take to Peter, so that the downward spiral stops, right? But what's going to happen is the body is going to make two wrongs equal a right. so that you no longer are free falling, but you landed in a place that's not stable. And so this is why, as women go through menopause, their risks of diseases tend to go up, is because the body stopped the bleeding, but it had to land in an unstable place. And so the next feather that lands will just send it into free fall again. And so this is why women will report, first I caught a cold, then I got diagnosed with this condition, then that condition, then this happened, then that happened. And it's just one thing after another because the body keeps landing in an unstable position and then something else destabilizes it, right? So you want to build up foundationally through, of course, nutrition, sleep, all the different things. Got to see where I am. Here we go. Stress and hot flashes. Had no idea. Thought I couldn't do anything but accept these damn hot flashes. So tell me more. Yeah, so reducing stress, right? That's going to be how we treat and protect our blood, right? So stress reduction techniques work because they're actually protecting our blood, right? And so when we protect our blood, we're also protecting our mind, right? And so breathing. Here we go again. Breath is so important, right? So what happens is when your body is under stress, it will shunt blood flow. So blood is really important for stress because what happens is your body will shunt all your blood to the middle of itself to protect the vital organs within itself, right? We see that with car accidents. So if someone has a major car accident and they have internal bleeding, right? We see suddenly, this is instantaneous practically, the body literally removes all the blood from the extremities and shunts it to the middle, almost instantaneously, when it perceives a rapid loss of blood with bleeding. So, you know, when we watch TV shows, for example, that have, emergencies, we see, you know, people are very pale, their lips are blue, you know, they're cold. That's because the blood has literally been removed from the extremities on purpose by the body to send it to the middle, to keep the blood in the heart and the lungs. And then that person will pass out, right? Because the body doesn't want to be trying to fight gravity to get blood to the brain, because the brain controls the heart and the lungs. So it'll make you go horizontal by passing out. So that way there's no gravity in the way and your body can get blood to the brain a lot more easily from the heart. And so we see this instantaneous shunting of blood to the center. And it's very obvious when someone's bleeding, all right? It's not as obvious under stress because it's much slower, but it's the same thing. So your body slowly starts to take blood from the extremities and the places it considers not important. It doesn't consider your extremities to be important when it's worried about your heart and lungs. And so, you know, we see numbness, the tips of the fingers get numb, tingling, hair thinning, hair dryness, skin dryness, aches and pains, arthritis starts to set in, right? We lose muscle mass, we lose bone structure, right? Osteoporosis or brittle bones is the body taking blood and resources away from those areas to take it to the center of the body. And what's interesting to note about Chinese medicine is they consider the musculoskeletal system to be the outside of the body. So they don't consider your bones and your muscles and your connective tissues and your skin to be part of the inside of your body, which is interesting. In Western medicine, we consider the surface of the skin to denote the outside from the inside. In Chinese medicine, they actually use the skeleton as to denote what's inside and outside the body. So physiologically, we see that what is discussed in Chinese medicine is actually more relevant. So the body takes from the musculoskeletal system and shunts it within. So what happens is you're deprived of blood in these areas. And if that gets worse, you're going to start being deprived of blood even in the critical areas, liver, gallbladder, spleen, gastrointestinal system. there will be pockets of areas in those places that will not get their fair share of blood. And so breathing, what that does is it opens up blood vessels. And so when you take a 5-second breath in and you allow a 5-second breath to come out very slowly and calmly, the reason that feels so good is because you are now releasing calming energy into your body. And so your blood vessels will open as opposed to constrict. So when you're under stress, they will constrict in the musculoskeletal system and in the deep cracks and crevices of a lot of your organs. So if you take good breaths, what happens is you're going to reduce your stress, you're going to open up blood vessels, and you're actually going to nourish tissues that were being malnourished before. Of course, in conjunction with food, right? So blood nourishing foods in Chinese medicine, the most obvious things are going to be things that have blood, right? So meats and animal products are the most obvious blood nourishing types of food in Chinese medicine. But again, you want to be careful because if you're a hot metabolic type, you don't want to be eating red meats and gamey meats, right? Elk, bison, those things will make you too acidic. So you don't want to use that as a blood nourishing strategy. But you can do egg yolks actually are quite blood nourishing, right? If you're not a vegan, of course. You can do poultry, you can do pork, right? Also, vegetables are blood nourishing. In particular, green leafy vegetables, spinach, kale, and also barley is very blood nourishing in Chinese medicine. Chinese dates or red dates, very blood nourishing. There are herbs such as dangui that are very blood nourishing in traditional Chinese medicine. So bone broth would be very blood nourishing in traditional Chinese medicine. So another way to help manage stress is more sleep. So we make blood when we sleep. And in Chinese medicine, they have a specific position that they say confers a benefit, and that's sleeping on your right side. The reason for that is the liver, which stores blood, is on the right side of your body. And your stomach, which should be empty when you're trying to sleep, should be up, and your liver should be down. So that way all the blood kind of goes down to the liver, so it can be properly stored in Chinese medicine. And then your stomach can be emptied because everything will come out of the stomach because it'll be higher up. And so that's the best position to sleep in according to Chinese medicine, assuming, that you can comfortably sleep in that position. So sleep is a huge one. And that's also happens to be a stress reliever, right? The more sleep you get, the more stress relief you will have. A lot of stress is due to sleep deprivation. And so for hot flashes in particular, you want to get those things treated, right? It's not always estrogen or lack of estrogen that causes hot flashes. Sometimes it's too much estrogen. So if your liver is struggling to break down estrogen, you can get hot flashes because of that. Also cortisol and thyroid. So if you're under a lot of stress and your cortisol levels are up, right, you might consider yourself to be a hot metabolic type if you have high cortisol, because cortisol is hot, so you'll actually feel hot. You might feel thirsty. So it could be related to high cortisol. And if that's the case, taking adaptogens would be helpful. And again, breath work, we just cannot overemphasize breath work. Taking breaths is really the most important thing with stress reduction. All right, so that was awesome. Wonderful questions as always. I hope this was of benefit to you. And as always, thank you so much for being here with us. And you're listening to Awaken Wellness Now. And until next time, I send you many blessings. Thank you.